Seniors, here are 12 reasons your legs may be getting weaker after 50. Have you noticed that climbing stairs, something that used to be so easy, now feels like a real challenge? If so, you're not alone. After turning 50, many people begin to see a drop in leg strength and mobility. But this decline doesn't have to be permanent. In fact, you still have the ability to turn things around. Strong legs are key to staying active as we age. They help us stay independent, move freely, and enjoy life well into our later years. Letting your legs grow weaker can reduce your ability to move around and increase the risk of falls, which becomes a bigger issue as we get older. But if you take action early, you can greatly improve your quality of life. This guide is here to offer useful and simple tips to help you build strength in your legs and bring back your energy. Let's take a closer look at what causes leg weakness and what you can do to fight back. It's time to take control of your health and move forward with more confidence and strength. Before we dive in, let me know where you're tuning in from today. Feel free to leave a comment and ask any questions you might have. Reason number 1, sarcopenia. Let's start with something called sarcopenia, which is the loss of muscle that comes with age. As we get older, our body starts going through changes that affect our strength. Sarcopenia is the gradual loss of muscle mass and strength, and it usually starts in our 30s but becomes more obvious after 60. Muscle fibers get smaller and fewer in number, and the body replaces them more slowly. This leads to weaker muscles, slower movement, and a greater chance of falling or getting hurt. Knowing about sarcopenia helps us see why it's so important to keep our muscles strong as we age. The good news is you're not helpless. This isn't something you just have to accept. Regular strength training is one of the best ways to fight it. Doing exercises that challenge your muscles helps keep them strong. You don't need fancy gym equipment either. Resistance bands or light dumbbells at home can do the job and help build endurance. What you eat also matters a lot. A diet high in protein helps your muscles grow and repair. Older adults especially need more protein than younger people. Adding foods like eggs, lean meats, dairy, beans, and lentils to your meals can help protect your muscles and keep you strong. Reason number 2, peripheral neuropathy, nerve damage in the legs. Peripheral neuropathy is another common issue, especially in older adults. It can seriously affect your leg strength and how well you move. This condition happens when the nerves that carry signals between your brain, spinal cord, and body become damaged. It's often caused by chronic conditions like diabetes or by not getting enough important nutrients such as vitamin B12. In cases like diabetic neuropathy, high blood sugar over a long time damages the nerves, usually in the legs. This leads to pain, tingling, numbness, or serious weakness that can affect your balance. A lack of vitamin B12 can cause similar problems. B12 is important for both nerve and blood health. Many older adults, especially those with certain diets or absorption issues, can become low in this vitamin. If untreated, it can lead to even worse nerve damage. To prevent or manage peripheral neuropathy, it's important to focus on both your medical conditions and your diet. For people with diabetes, keeping blood sugar levels under control through medication, diet, and lifestyle is key. Doing this slows the nerve damage and can help reduce symptoms. Regular doctor visits, blood tests, and staying active all play a big role. Getting enough vitamin B12 is also essential. Eating foods rich in B12 like dairy, meat, and fortified cereals should be part of your daily meals. If you can't get enough through food, supplements can help. Regular checks of your B12 levels can catch a deficiency early and help prevent nerve problems from getting worse. Reason number 3, peripheral artery disease, PAD. Peripheral artery disease is another condition that affects many older adults. It causes reduced blood flow to the legs, which can make walking or moving around painful and difficult. PAD happens when plaque builds up in the arteries, narrowing the blood flow. When you're walking, your leg muscles need more oxygen, but the narrowed arteries can't keep up. This leads to pain, cramping, or a heavy feeling in the legs, known as claudication. These symptoms usually ease when you rest. Managing PAD involves making lifestyle changes and in some cases using medications. One of the most important steps is quitting smoking, since it makes PAD worse by causing more artery damage. Controlling your blood pressure and cholesterol through diet, exercise, and medications also helps reduce symptoms and slow the disease. Walking is one of the best exercises for PAD. A guided walking plan can improve blood flow, reduce pain, and help you walk farther. These programs usually begin with short walks and slowly build up as your tolerance improves. The discomfort felt during walking isn't harmful. It means your body is pushing its limits, which is needed for progress. Regular check-ins with your doctor are important so treatment can be adjusted if needed. Reason number 4, vitamin D deficiency. Vitamin D deficiency is very common in older adults and has a real impact on muscle strength and balance. This vitamin is important not just for healthy bones, but also for keeping your muscles strong. As we get older, our skin doesn't make vitamin D from sunlight as well, and our kidneys aren't as good at converting it to its active form. This drop in vitamin D can lead to weak leg muscles and more falls, making daily tasks harder. You can prevent vitamin D deficiency by spending some time in the sun. Just 10 to 15 minutes of sunlight a few times a week can help. Still, since older adults don't produce vitamin D from sunlight as easily, sun exposure alone might not be enough. That's why getting vitamin D through your diet is also important. Fortified foods like milk, cereals, and some juices, along with natural sources like egg yolks and fatty fish, can help. Supplements can be useful too, especially if you don't get much sun or have dietary restrictions. Taking vitamin D in supplement form can support muscle strength and help lower your risk of falls. It's also a good idea to talk with your doctor about checking your vitamin D levels to know if you need a supplement or dietary changes. Reason number 5, sedentary lifestyle. A lack of physical activity, especially common in older adults, plays a big role in weakening leg muscles and overall physical decline. The saying, "use it or lose it," becomes especially relevant when it comes to keeping muscles strong and functional. As people get older, long periods of inactivity often lead to muscle loss, which can lower mobility and independence. Inactive muscles tend to shrink and weaken, which can affect balance and raise the chance of falls and injuries. The good news is this decline can be prevented by adding more movement into daily life. Simple activities like walking, swimming, or practicing Tai Chi can make a noticeable difference. These low-impact exercises are gentle on the joints while still helping to maintain muscle and improve heart health. Walking, for example, activates multiple muscle groups, encourages blood flow, and helps build stamina. Swimming offers a full-body workout without straining the joints, making it a good option for those dealing with joint pain or stiffness. Tai Chi combines gentle movement with focus and breathing, helping improve physical balance and mental calm. You don't need an intense workout routine to benefit. Even small changes can lead to better health. Taking short walks daily, like going to the store on foot instead of driving or walking in the park, can help a lot. Group activities like water aerobics or Tai Chi classes can also be socially engaging, helping you stay motivated and connected. Setting simple goals and gradually increasing the amount and intensity of activity can make it easier to stay consistent. Sticking with regular movement is key. Ongoing physical activity can slow muscle loss, maintain strength and flexibility, and lower the chances of age-related health problems. Reason number 6, osteoarthritis, also known as degenerative joint disease. Osteoarthritis, OA, often referred to as wear and tear arthritis, is one of the leading causes of leg weakness in adults over 50. It mostly affects joints that bear weight, such as the hips and knees. This condition develops as the cartilage in joints wears down over time. Without that cushioning, the joints become stiff, painful, and harder to move. Because of the discomfort, people often avoid physical activities, which leads to more muscle weakness and limited movement. Managing osteoarthritis and its effects on leg strength means using both medical and lifestyle strategies. Low-impact exercises like swimming, cycling, and water aerobics can strengthen muscles without putting pressure on painful joints. These activities also help with flexibility and keeping joints moving freely. Strength training is another important piece. Exercises like squats, leg presses, and lunges, when done with care, can build up the muscles that support the joints, offering them better protection and stability. Medical treatments are also an option. A healthcare provider might suggest anti-inflammatory drugs, corticosteroid injections, or even joint replacement surgery in more serious cases. These treatments aim to reduce pain and help joints move more easily, so individuals can stay active and continue exercising. Reason number 7, medication-induced myopathy. Muscle weakness caused by certain medications is a lesser known but important issue for older adults. Some prescriptions can lead to gradual muscle loss, and the problem can go unnoticed. One well-known group of medications linked to this is statins, which are used to control cholesterol. While they're helpful for heart health, statins can sometimes cause muscle pain or weakness, a condition known as statin-related myopathy. This discomfort can discourage people from being active, which in turn makes leg strength worse. If muscle weakness becomes noticeable, it's important to speak with a healthcare professional. Regular reviews of all medications should be part of routine care, especially when new symptoms appear. Doctors may change the dosage or suggest different medications if needed. For example, if statins seem to be the issue, switching to another cholesterol treatment or adjusting the amount might help reduce side effects. Other medications that can affect muscles include corticosteroids and some types of chemotherapy drugs. Managing these issues doesn't mean stopping important medicines. It's about finding a balance that supports both treatment and quality of life. Staying physically active based on your ability and eating a nutritious diet are also key ways to reduce the impact of medication-related muscle loss. Reason number 8, osteoporosis and fractures. Osteoporosis is a serious condition among seniors where bones become weak and more likely to break. This can lead to serious injuries, especially in areas like the hips, spine, and wrists. Even small falls can cause fractures, which often result in long recovery times and reduced mobility. Being unable to move for extended periods leads to muscle loss and makes the problem worse, sometimes affecting the ability to stay independent. To help avoid osteoporosis and its complications, focusing on bone health is essential. Getting enough calcium and vitamin D plays a big part. Calcium keeps bones strong, while vitamin D helps the body absorb and use calcium properly. Older adults are usually advised to stay active with weight-bearing and strength exercises to help maintain both bone density and muscle strength. In some cases, doctors may prescribe medications like bisphosphonates, which help slow down bone loss and lower the risk of fractures. Regular bone checkups and density scans can catch problems early. That way, steps can be taken before serious damage occurs. Seniors should work with healthcare providers to get a plan tailored to their specific health needs and risks. Reason number 9, obesity and sarcopenic obesity. Carrying too much body weight can strain leg muscles and joints, especially in older adults. But when obesity is combined with muscle loss, a condition known as sarcopenic obesity, the effects can be even more harmful. Excess fat puts more pressure on joints like the knees, hips, and ankles. At the same time, when fat replaces muscle, strength decreases and movement becomes harder. This combination makes it more difficult to stay active, which can speed up both muscle weakening and joint problems. Dealing with these challenges takes a balanced approach. Eating a healthy diet that includes enough nutrients but isn't high in unhealthy fats is important for managing weight and supporting muscle health. Physical activity is equally necessary. A mix of cardio exercises like walking, biking, or swimming, along with strength training, helps burn fat and build muscle. Resistance exercises like using bands, light weights, or bodyweight moves such as squats are especially helpful for strengthening legs and improving joint stability. Reason number 10, stroke, also known as cerebrovascular accident. Strokes are a major health concern, especially for people over the age of 60. They affect not only the brain but also physical mobility, particularly in the legs. A stroke happens when blood flow to a part of the brain is cut off or reduced, which means the brain tissue doesn't get enough oxygen and nutrients. This can cause brain cells to begin dying within minutes. When that happens, the motor pathways in the brain responsible for movement, especially those controlling the legs, can be seriously damaged. If the stroke affects areas like the motor cortex or the corticospinal tract, it often results in weakness or paralysis on one side of the body, known as hemiparesis. This typically impacts leg function on that side, making it harder to walk, maintain balance, or carry out daily tasks without help. These physical limitations can have a major effect on a senior's independence and quality of life. Recovery after a stroke usually involves a strong focus on restoring leg strength and movement. Physical rehabilitation can include exercises, walking practice, gait training, and the use of walking aids when necessary. Stroke prevention is equally important and involves managing risk factors early. One of the most important steps is controlling high blood pressure, which is a top cause of stroke. Keeping blood pressure in check through regular monitoring, lifestyle changes, and medication when needed can significantly lower the risk. Other steps include quitting smoking and managing other health issues like diabetes and atrial fibrillation. A diet that's low in sodium and rich in vegetables and fruits also supports heart and blood vessel health. Keeping a healthy weight and staying active are other key ways to reduce stroke risk and protect mobility. Reason number 11, lumbar spinal stenosis. Lumbar spinal stenosis occurs when the spinal canal in the lower back narrows and puts pressure on the nerves that travel into the legs. As the space around the spinal cord shrinks, nerves can become pinched. This often leads to symptoms such as aching, heaviness, or a feeling of weakness in the thighs and calves, especially when standing or walking. You may notice relief when you lean forward or sit down. Over time, nerve compression can make it hard to walk more than a few blocks without needing to rest. It can also affect balance and coordination. Diagnosis usually involves a physical exam, imaging tests like MRI or CT scans, and evaluation of walking patterns. Treatment starts with non-surgical methods. Physical therapy focuses on exercises that strengthen the core and the muscles supporting the spine. Stretching routines for the lower back and hamstrings can also ease pressure on the nerves. Pain relief may come from over-the-counter anti-inflammatory medication or targeted injections such as epidural steroid shots. If conservative measures don't bring enough improvement, a doctor may recommend surgery to widen the canal and free the nerves. Procedures like laminectomy or laminotomy create more space and can restore the ability to walk longer distances. Early attention to lower back posture, regular gentle exercise, and maintaining a healthy weight can help delay the onset of spinal stenosis. If you experience leg weakness or changes in walking ability, consult a healthcare provider for assessment and a personalized plan. Reason number 12, hypothyroidism. Hypothyroidism happens when the thyroid gland doesn't make enough hormones that control your metabolism. In older adults, this can develop slowly, often going unnoticed until muscle problems start. Thyroid hormones help muscles use energy and recover after activity. When levels are low, you may feel unusually tired, and your muscles can ache or feel stiff. In particular, leg muscles may feel weak or heavy, and your reflexes may slow down. These changes can affect your balance and make movements like rising from a chair or climbing stairs difficult. Diagnosing hypothyroidism is straightforward with a blood test measuring thyroid-stimulating hormone, TSH, and thyroxine, T4. If results show low hormone levels, doctors usually prescribe a daily pill to replace what your body is missing. Over weeks to months, energy returns, muscle aches ease, and strength improves. Alongside medication, eating a balanced diet supports recovery. Foods containing iodine, found in saltwater fish, selenium in Brazil nuts, and zinc in legumes help your thyroid work better. Gentle strength exercises, such as seated leg raises or light resistance band workouts, can rebuild muscle tone without overloading joints. Follow up blood tests every few months. Ensure your dose stays on track. By catching and treating hypothyroidism early, you protect your muscle strength and mobility as you age. Now that we've looked at the different causes of leg weakness and reduced mobility in older age, it's time to think about how to protect your health going forward. Start by picking just one or two of the practical tips we covered, whether that's adding regular weight-bearing exercises into your routine, improving your nutrition with more protein and essential nutrients, or working with your doctor to manage any medical conditions you may have. These small daily changes can lead to long-term improvements in your mobility and overall well-being. Talking with your doctor about a health plan that fits your personal needs can help you understand the best ways to stay strong and independent as you age. Every positive action you take now lays the groundwork for staying active and capable in the future. Aging is something we all go through, but staying healthy and mobile is something you can take charge of. So make the decision to start today. Build healthy habits, keep open communication with your healthcare provider, and take steps that support your strength and stability for the long run. If you found this information helpful, feel free to share your thoughts in the comments below. Let's support one another and grow a helpful community. And don't forget to subscribe to our channel for more practical health tips and updates. Together we can make every day better and more active.